Hello, my movement of choice is the dumbbell shoulder press, and I'm choosing to show this and demonstrate and talk about it in the seated position instead of standing. So first, the movement description. The purpose of this exercise is to strengthen the upper extremity in a push pattern, and it focuses on strengthening and stabilizing the shoulder. For the starting position, the bench that you'll be sitting on, you want to be at about a 90-degree angle, just in the sitting upright position. And for the arms, you want your elbows at a 90-degree angle. You also want your upper arms to be in line with your shoulder, and you want vertical forearms, so facing straight up. And then you want your wrist to be neutral in a pronated grip. For the movement pattern, the concentric is pushing up the weight, and for the top position, which is kind of like the isometric, the elbows are extended in this, and then the eccentric is the lowering phase, so it kind of looks like this, with you'll see it with one arm like that. That would be the movement pattern. Posture, you want a neutral spine, neck, head, and pelvis, and you want your feet flat on the ground, and your legs should be like a 90-degree angle as well. For support, for technique, it's a controlled tempo, and you want symmetrical arm movement. You don't want to be doing different or pushing the weight up at different times, and you want to exhale during the concentric phase and inhale during the eccentric, and you don't want momentum lifting the weight. You really want to engage those muscles and lift the weight by doing that. For the anatomical breakdown, phases of the movement, for the concentric, it's shoulder abduction, elbow extension, and scapular upward rotation. The top position is shoulder, elbow. The shoulder and elbow is close to full range of motion. It kind of depends on the mobility of the individual. And the eccentric is opposite of concentric, and it's a controlled movement down. You don't want to do it too fast because it doesn't help with muscle engagement and can cause injury. For musculoskeletal terminology, the shoulder is the glenohumeral joint, and it uses the deltoid and supraspinatus to lift the weight. For elbow, it's the humeral ulnar joint, and it uses the triceps. For scapula, it's an upper lower trapezius with serratus anterior for that movement as well. For the muscle contraction, like I said before, the up phase is concentric, top is isometric, and the lowering phase is eccentric. For the muscle contribution, the agonist is the deltoids and triceps brachii. The synergist is supraspinatus and serratus anterior and traps. Stabilizer is rotator cuff and the core. The antagonist is the lats and biceps. For functional anatomy analysis, the length-tension relationship is in between the starting position and ending position. The length-tension relationship is the highest, which would be maximal force production. For force velocity, the heavier the load, the greater the force demand, and during a fast press, force production would decrease, but power would increase. So if you're doing heavier weight, it's going to be slower, so then power would not be as much as if you were doing a lighter weight. For stretch sorting cycle, pausing at the bottom between reps increases the cycle, decreases the cycle, and it increases the concentric demand. So when you're pausing right here, you're not using the momentum to get up, and then it engages the muscles more and makes it like harder. This would be continued. The range of motion, again, it depends on the individual. For the elbow, it should be around 80 to 100% extended, and the glenohumeral should be 70-90% of abduction. So when I go up, I go to about right here. So it's not fully extended. Again, it kind of just depends on the person. The elasticity is the ability of the tissue to return to normal after a stretch. You can think of this kind of like a rubber band. So if you stretch it too far, it won't go back, and that would be considered like injured of the muscle. But if you stretch it a good amount and it's fine, it goes back to normal, that would be the concentric and like eccentric phases. For extensibility, the muscle lengthens without damage. This again is like part of the contractions. If it's not lengthened too much, it won't be damaged. For contractility, force generated by actin-myosin cross bridge. So around halfway up through the motion, that would be where the highest force is generated. For kinetics, on my presentation, I have a free body diagram, and with that, I have the measurements and stuff for this. So this movement is a third class lever. Say the force of the dumbbell is 20 kilograms. That would be 196.2 newtons being force produced. And then the force of the muscle would be 1,472 newtons. Again, that's with the measurements on the free body diagram. The internal force would be the deltoid supraspinatus triceps and serratus anterior. For external force, it'd be the gravity against the arm and the dumbbell pushing down against it as well. And then additional forces could be like friction of the joints and stuff, and force couple from scapula. So for kinematics, the glenohumeral is in the frontal plane of motion and the sagittal axis, and it's primarily shoulder abduction. For the sternoclavicular joint, the frontal plane, sagittal axis, and it is used for scapular upward rotation. For the elbow, it's a sagittal plane, frontal axis, and elbow flexion and extension. And then lastly, for the wrist, it's in the sagittal plane, frontal axis, and then the movement would be just slight wrist extension. But during the movement, the wrist should not be moving, so it just be fixed like this and slightly extended. For measurement of force application, the two measurements I chose to do is work and power. For work, it's force times distance, and for the total work of both arms, I calculated it to be 235.4 joules, and then for power, it's work over time, and for that, I calculated it to be 98.1 watts in concentric time. For the application discussion, potential injury could be excess lumbar extension, reduced core stability, limited shoulder flexion or thoracic extension. This can reduce overhead efficiency and cause lumbar strain, especially when you go up in weight. So you want to make sure you have proper form to reduce this injury as well. The second potential injury could be due to limited scapular rotation. This can be because of a weak anterior serratus and or traps, and this causes risk of subacromial impingement, joint stress, and rotator cuff tendinopathy. You can improve this by thoracic mobility and improve rotator cuff stability. But lastly, the two exercises that I have picked to improve this would be a half kneeling landmine press. This reduces lumbar compensation, and then it focuses on strengthening scapular plane and improve the core, which is important when you go up in weight, like I mentioned. This naturally promotes upward rotation, increases vertical force alignment, and half kneeling increases stability. Overall, this improves strength and stability for the shoulder press. Second exercise I chose is the wall slide with serratus activation. This improves scapular upward rotation and improved posterior tilt. It trains the serratus in a closed chain way and improves motor coordination for upward movement. In a shoulder press, this exercise will help encourage pressing the weight straight up and having more stability in this, and engages the scapula, so then it'd be more activated during this movement to help, and other muscles won't have to compensate as much. And that I will add in the clips for those to show how to demonstrate it, and then okay, so for the landmine press, you're gonna want to, since it's half kneeling, it'll look like this. You want your leg at about a 90-degree angle, and you want to make sure you have a neutral spine, so you're going to want to engage the core, and then you'll have a bar that's connected on the ground, usually a barbell, or it is a barbell, and when you press up, you want to go like, it'll be the opposite arm with the leg, and you'll press up like that. You'd want to focus on not rotating your body and keeping the hips in line straight forward, and then go up like that and come back down. So that is the landmine press. The second exercise is the wall slide. So you'll be standing like this against the wall, a little bit forward lean, and you're just gonna go straight up against the wall, and then that will engage the scapula. So thank you for watching my presentation.